All right, well, welcome. Thanks for coming out today. I'm Emily Narog, a physical therapist with Premier. I work up at the Kaufman YMCA. We have a PT clinic up there. Been there about 3 years, been a therapist about 4. And I'm presenting to you today about arthritis, which is a very, very common thing that develops through our life, but can be very painful and very limiting. So what do we do about it? How do we continue our lives and what we want to do despite this development? Through this presentation, if you have questions, feel free to ask, but I do have a slide at the end to take most questions, so if it can wait, we'll take it then. But through this presentation, we should be able to define what is arthritis. I want to show you a few exercises that can help with strengthening. Particularly in this presentation, I'm going to focus on when we get to a particular joint, the knee, because that seems to be the most common joint that's affected in people or limiting people. I want you to understand safe exercise prescription. So where do I start? How do I build? How do I modify for what I'm needing? And then how can physical therapy help? When am I at the point that that might be worth pursuing in my care? So arthritis at its core is a cartilage issue. So we have cartilage that covers the ends of our joints, particularly more so thicker around our weight-bearing joints, so our knees and our hips. But it's around our shoulders and elbows and things like that as well. What the cartilage does, it kind of acts like a cushion to where it absorbs force, but then it also is a bit of a lubricating factor. So the analogy I like to give is like an ice skating rink. Think fresh ice, the Zamboni just came over, it's smooth. If we go skate on that, it's going to be real slick. It's kind of how our cartilage starts and is through most of our, I'd say, teens and early 20s. But then just through life, normal activities, walking, exercise, just daily tasks, if we have a physical job that we do, that contributes too. Normal wear and tear happens to this cartilage. And so back to the ice example, think about if a bunch of people came and skated on that ice. After a few hours, it's going to be pretty rough. We need the Zamboni to go over that again. The only issue with our joints is once we get to that point of wear and tear, we don't have a magical Zamboni that can just come back over and re-lubricate everything. What happens when the cartilage starts to degrade, though, is we don't have as good of shock absorption, and then that can create inflammation, and the ends of our bones can almost grow little, we call them osteophytes, but they're little bony growths, that smooth joint surface is now rough, and so normal movements that didn't used to hurt now hurt. Just everyday activities like this can increase pain. Stairs, laundry, squatting, getting in and out of cars, putting shoes on, walking. And like I said earlier, a lot of today's discussion, we're just going to focus on the knee because it's a very common one. The principles I talk about could be applied to any joint in your body, but that's the primary one I'm going to stick with. So arthritis is very common. How many in this room have arthritis that they know of? Yeah. I'm raising my hand too, because if you did an image of my back or my knee, I probably already have a little bit built up in there from some sports activities and things I've done in my life. So common. But not everyone with arthritis is having pain. I have arthritis, but it doesn't limit me. Some people have arthritis and it's horribly limiting. So a common aspect of arthritis can be pain, but it can also be weakness. So a lot of times muscles around the arthritic joint become really weak, and that's important because those muscles are part of the shock absorbing factor of our joints. So if we become weaker, particularly in our quad, which is the big muscle on the front of the thigh, as that becomes weaker, every step we take, every squat we do, it's not helping us anymore. And all of our weight and force is going right into that joint. Okay, let me see what else I didn't talk about on here. With age, muscle weakness is common. And so that's where there's a really big emphasis on exercise and strengthening to try to mitigate what changes we can do something about versus what changes we can't do something about. We can't always stop arthritis from developing, but we can strengthen to the point that we can still perform our day-to-day tasks without feeling limited by the arthritis. So typically it's going to affect bigger joints, hips, knees, low back. That being said, I know plenty of people who have shoulder arthritis to the point of needing replacements, wrist and hand arthritis, ankle arthritis. It really can develop in any joint, but our ones that are more force loading, or they take more of the force of our body weight, our hips, knees, and low back are the more common ones. Usually this is going to feel like stiffness, discomfort. I can't move as far, I don't feel as strong. It's usually gonna be worse when you first wake up. Like when you first wake up, you're gonna feel really stiff. And then you kind of get moving and work through it, and it starts to get a little bit better within that first 30 minutes of movement. But I often see it doesn't just stay good the rest of the day. It tends to kind of go in a bell curve. People will feel not as good in the morning, then they'll start moving, they feel a little better, and then by the end of the day, if they've done a lot, it might be acting up again then as well. So a comment on imaging here briefly. A lot of times if we go to the doctor for joint pain, they're gonna say, okay, let's take a picture of it. Or maybe go try PT first, then we'll take a picture of it. But when they do the imaging, a lot of people get freaked out or a little nervous when they see the words degenerative changes, because that's a really common one that's in there. But I wanna comment on it real quick because it doesn't always mean pain, or it's not always something horribly wrong that we need surgery for. Degenerative change is very common, and it really just means, hey, you're using your body. You move your body through life, and your joints have adjusted to that. The image, the infographic on the side here is one of my favorites because it goes through talking about different there was a study done where they looked at different imaging of different joints, spine, shoulder, hip, and knee, and we're looking at people over 40 years old who didn't have symptoms. So people who didn't have any pain, weren't being limited, they looked at their imaging. In the neck, up to 35% had a disc bulge. Up to 96% had some disc degeneration in their low back. Up to 84% had a disc bulge in their low back. With the hip, up to 54%, a labral tear, up to 12%, an issue with the cartilage. Shoulder, up to 72%, a labral tear. Knee, 43%, cartilage lesion. 19%, a meniscus tear. 37%, osteophytes, which is arthritis buildup. So someone can have on a picture a joint that looks really not so great or some words that are really scary. It doesn't always equate to how they're feeling and how they're limited. So I just say that to say the imaging shouldn't dictate our assessment of our own health. It may give the doctor information on what is fixable, what is not, but really how you feel, how your strength is, what you can do in your day-to-day, that's, I think, a bigger indicator of your overall health than the imaging. Because really, most people over 40, you go do an image, they're gonna have degenerative change, or they're gonna have something wrong, but not everyone is so limited. So we're gonna focus on the things we can do something about, which is exercise and strengthening. Okay, so the American College of Sports Medicine is kind of what athletic trainers, PTs, orthopedic doctors, we kind of use this as the gold standard of how we tell people how to exercise. And they're gonna recommend a minimum of 150 minutes a week of moderate exercise, or 75 minutes a week of vigorous exercise. What's moderate, what's vigorous? That really depends on you. What's vigorous for me might not be for you. What's vigorous for you might not be for me. It's kind of per person. So I have a slide coming up here giving a few examples of what each are. But really, I classify it as moderate would be I can carry a conversation, but I feel like I'm maybe working a little harder. Vigorous or intense would be I'm having to focus so much I maybe can't carry on more than a sentence or two before I need to stop to breathe a little bit. That would be more of our vigorous. There's a lot of ways to split up your 150 minutes a week. That can be 5 days of a 30-minute session. That can be 3 days of a 50-minute session. You have a lot of flexibility in that, but that's kind of what the ACSM recommends for exercise amount. We want to alternate between aerobic activity, strength training or resistance training, and then flexibility. Resistance training, they're saying do that at least 2 times a week. Flexibility or stretching, they're saying do that at least 2 times a week. I think at first exercise can feel overwhelming, especially if you don't have a current rhythm that you do. And so starting somewhere is something. So starting with, if 30 minutes is too much, maybe you do a few 10-minute sessions through your day. I'm gonna walk for 10 minutes here. I'm gonna strengthen for 10 minutes here. I'm gonna stretch for 10 minutes here. You know, you can start small and build up from there. And if you look at these numbers, it's kind of like, okay, that's a lot. 150 minutes of aerobic, 2 times a week of strength training, 2 times a week of stretching. How am I gonna fit all of that in? I have in a few slides from now a example of maybe how to split that up, because it seems like a lot at first, but ends up being pretty doable, I think. So here we go. What is moderate intensity exercise? Generally, this could be like a brisk walk. So not my slow, comfortable pace. Maybe I'm going a little faster than my norm. Maybe I'm doing some yard work, a little more intense house chores, doubles tennis, I guess, for anyone who does tennis, pickleball, dancing, or some lighter weightlifting. All of those, depending on how intense you go, I guess, you could usually carry on a conversation or a few sentences here and there. Vigorous exercise is going to be more, I can't maybe carry on a full conversation through this. I need to focus on what I'm doing. Running, swimming, jumping rope, playing basketball, shoveling, tennis singles, I guess. I've seen some pretty intense pickleball, so maybe that could be on that list. Or heavy weightlifting. With the vigorous intensity exercise, we don't need the full 150 minutes a week. We need more of the 75 minutes. It's because this is requiring a lot more of our body. I'd say most people I'm treating or working with that are able to be active in their community, like most of you are, they're more so doing the moderate intensity exercise. I know a few who choose the vigorous activity, but I'd say most commonly I see people choosing more frequently less intense exercise, which is still good. Overall health benefits other than helping our joints, exercise is great for chronic health, things like diabetes, high blood pressure, heart disease, and can help them from getting worse. So if you're currently dealing with any of these, not only is exercising regularly going to be helpful for joint health, but helpful for preventing these from deteriorating further. It can decrease risk of cancer, help prevent a return of cancer, good brain health, reducing risk of Alzheimer's and dementia, reduces fall risk, which is huge. Strength, balance, and flexibility are all a very important part of that. And how your joints are feeling are a big part of that. You know, if my knees hurt, I'm maybe not gonna walk the way I normally would. My balance is going to change, could put me at a greater risk of falling, which we really want to prevent just because that is a higher risk of injury that we don't want to do. And then exercise generally is going to help you stay independent. I would say in my line of work, the individuals I see who are, we'll say 65 and older, who actively work out. They have some kind of routine. Most of them go to the YMCA, and we talk about it just because I'm attached to there. But most of them have a routine over there several days a week, and they are the ones who I see are the most doing the best with their daily activities still. They can do everything they need to and more because they have that rhythm. So I think that's one of the most important things here is maintaining your independence. Before I move into this slide, another component of joint health I want to talk about that Janella and I were actually talking about earlier is not only general changes that happen with life, but genetics can play a little bit of a role as well. I treat a lot of individuals who have what's called Ehlers-Danlos syndrome, which is a hypermobility syndrome. And a lot of times people with that condition have very elastic connective tissue. So their tendons, their cartilage, their muscles, they tend to break down a little bit easier than most people. And so not that everyone has that condition, it's a pretty rare condition, but that can play a bit of a role too. So even though I'm talking about exercise, it's important to know your body, and if your doctors shared any other diagnoses like that with you, that could be playing a role as well in kind of prognosis of things. Okay, so talking more about exercise for improving our tolerance with our daily activities. Many studies have shown that doing prescribed exercises So what that means is something regular, something that's challenging, not just I'm going to sit on the floor and stretch and that's all I do. Doing a variety of things can overall decrease pain levels and improve performance of daily tasks. And a lot of the exercise plans in those studies, they weren't a ton of exercises. I think a lot of people look at exercise like I have to do how many things to hit how many muscles. It doesn't always have to be very drawn out. 5 or fewer exercises are what were used in these plans. And a lot of them were variety. Some were walking, some were specific muscle strengthening, but it doesn't have to be a whole book of exercises. Usually 3 or 4 are what I would give someone to stay consistent with, and that consistency is the bigger factor that's more helpful. Evidence has shown benefit in a variety of programs, so not just I'm only going to walk. It's, I'm going to walk this day. Maybe I'll ride a stationary bike this day. Maybe I'll strength train on this day. We want to expose your body to different stressors so that your body can handle the different requirements of everyday tasks. Like the ACSM recommended, we want to do each type of exercise about 2 days a week, maybe 2 days a week of strengthening, a few days a week of walking. The most important part with that, though, is finding exercise you feel comfortable with. I hate running. I'm not going to go run a half marathon. That would be horrible. But I do like strength training, so I'm going to choose to do more of that. I like walking. I like swimming, so I'm going to choose to do more of that. One of my best friends loves running, loves it. She does half marathons all the time. That's best for her. So it's really important for you to explore different types of exercise to find what you like, and then stay consistent with that. Okay, what to expect from participating in exercise if you have knee arthritis, which I'd say is a pretty common area to have arthritis. I think the biggest issue I see with people is they give up too soon. Exercising for the purpose of decreasing arthritis pain or joint pain isn't fast. It's not, I'm going to exercise for 2 to 3 sessions and it's going to feel better. It'll often take 2 to 3 months before you even start seeing a bit of change. And that's where we lose people, is that takes a lot of commitment and endurance and dedication to seeing it through. But every day is a new opportunity for exercise and a new opportunity to do something. Rest days are important, but on most days, if you can do something, that is much better than nothing. It's important to be patient with yourself because, it may take a while, 8 to 12 weeks, so that's that 2 to 3 months. You should see little changes as you go, but significant improvements in your day-to-day, they might not happen for that long. So I just think it's an important timeline to kind of keep in the back of your mind there. The goal is that you start somewhere. You start small and you start building it up until you have a good routine or a good program going. As you do that, it's really normal to get sore as you're challenging yourself. We call that delayed onset muscle soreness, or DOMS, D-O-M-S. That soreness is typical. It usually won't come on until the day after you've exercised or even 2 days after. That's normal. A lot of people exercise, they'll feel that normal expected soreness and they'll quit because they say, oh, it hurt. I'm not going to do that again. But some of that, if you were challenging yourself enough, is expected. So keep that in mind too. It may not feel good at first. The rule of thumb we want to use though is, let's say you exercise and the whole next 24 hours you are in pain. Not just a little sore, but pain, and it's limiting you. Okay. You probably did a little too much. But if you don't feel it initially, it just feels sore 1 to 2 days later, and it's only there every now and then, that's going to be pretty expected. So stick with it through that. If you have a day of more pain, I just say take a rest day, stretch. Change up what you're doing to where you're working a different region of your body instead of the one that is hurting. Okay, so if you haven't exercised recently, right, start small. That's what we've been saying. Start by maybe a 5 to 10 minute walk. I mean, a lot of individuals, that even 10 minutes in a row is a lot. That feels like too much, sometimes is painful. Start with 5 minutes, build up to 10, build up to 15. A really easy way to start would be the first week or 2 of initiating. Start by just aiming to complete your full amount of time you've set for yourself. And then the next few weeks after that, weeks 3 and 4, you can start challenging other aspects. How fast am I walking? What's my form like? How far am I going? Those would be other factors. The first step we want to do is I'm just going to complete it and I'm going to stay consistent with it. That's the very, I think, #1 thing to be in a habit with. On here it says aim for 3 to 3.5 miles an hour. I'm not married to that number. I think that you got to walk at a pace that you feel safe with, and that challenges you, and that's very different for every person. So, I don't know, it's a recommendation, but you got to just find where it's that pace where, okay, I'm breathing maybe a little bit heavier, but I could still talk to someone if I needed to. Let's see here. Yeah, at the bottom, really once you're comfortable in that routine, the way you progress is either length of duration, speed, incline, distance, those kinds of things. Other ways people will do it if they don't want to use a treadmill is you can use a step counter or a speedometer. I think a lot of smartphones tend to, or I wear an Apple Watch, a lot of watches tend to track that kind of stuff. They used to have the recommendation of 10,000 steps a day. That's not really the solid recommendation anymore. A lot of people have seen health benefits of just 5,000 or 7,000 steps. On here too, not even every day, 3 to 5 days a week is kind of a good goal. So there's a lot of different ways to measure your exercise. It doesn't always have to be, I'm going to go for this long on this treadmill, 10 minutes on a treadmill. It could be, I'm going to go for, let me get 2,000 steps during this walk and then go about my day. So there's different ways to measure it. A reminder at the bottom there says aerobic activity. We're aiming for that 150 minutes a week. So that's like a 30 minutes of something 5 days a week, 30-minute walk. You could break it up into smaller quantities if necessary, but just a reminder on that number is what we're aiming for. Okay, if you desire to vary your routine for more than walking, the focus would be on, let's say you don't like walking. It's boring. You just don't like it. Look for other activities, a stationary bike, a stationary arm bike. Aerobic activity in the pool is wonderful, I think, for arthritis. I do a lot of pool therapy down at the YMCA in a warm water pool, and I find a lot of my individuals who have arthritis, that's a really good environment because it unweights the joints, and then we exercise on top of that. So that counts as aerobic activity. We want to exercise doing something every day. The 3 main categories, like we said already, are those aerobics, strength training, balance, and flexibility. Strength training is anything resistance-wise. So this could be body weight. Like if I did a push-up, that's strength training, but I didn't have to use any other equipment. There's also machines you could use, bands, dumbbells, that's all in the strength training category. Balance and flexibility, this could just be your typical stretching, but things like yoga, things like Tai Chi, if anyone's done that, those are really good for muscle control, muscle stability, balance. Really love it for that. Any questions thus far? Doing okay? Okay. Let's start talking a little more about the knee. We're going to dive in specifically for what exercises can you do to strengthen the quads. So the quads are the muscle on the front of your knee. They go from the hip, they cross the hip, come down your thigh, and then cross the knee. Their job is to flex your hip and to straighten your knee. If you lifted your leg forward, that's your quad there. Really important for stairs, bending down to the ground, getting out of a chair, walking. Almost all of our daily tasks are really going to involve these quads. And the quad is really important for the knee because it's that secondary shock absorber. When we have strong quads, if I take a step, that quad is contracting to help decrease the amount of force going right into my knee. So let's say our knee has that worn cartilage. Having strong quads is really important because I don't have the cartilage to rely on anymore. I need the quads and the other muscles to be that secondary shock absorber for me. Okay? Hip and other leg muscles are also really important. They're really commonly weak in most people. I'd say we're in a culture of sitting. We're in a very sedentary culture. And a lot of times the hips and the glutes tend to weaken, calves tend to weaken and get tight. These imbalances can make us put way more pressure through our knees than necessary. So really important for overall lower body strength and flexibility. Lower body, yep, hamstrings, quads, so front and back of the knee, and then the sides of our hips are very important. There's a lot of different ways to exercise your legs. So many different ways. A lot of people, I think, will think back to exercises that maybe they did when they were 20. You know, I could leg press however much, I could squat however much. And they want to get back to that. And that's not always realistic for what your pain is telling you right now. So let's say pain is a big limiter, and even bending down to the ground is really painful. Maybe we start with some unweighted exercises, sitting or laying down. That could be a better place to start. Some people are really a fan of push through the pain, but really with arthritis, that's not my goal. My goal is to still give you ways to strengthen that aren't going to flare your pain. It's going to do two things. It's going to keep you moving even after we do strength exercises, but two, it's going to keep you motivated. It's not going to deter you from, I'm not going to exercise because that's going to make my pain so much worse. So we do want to respect the pain a little bit. So, okay, some examples. These are some examples of unweighted exercises. So ones that I'm not using any extra weight. I'm not on my feet. I'm either sitting or laying down. This first one's called a long arc quad. That's just the name in the exercise community, physical therapy community that is commonly used. This is like if all of you are sitting, if you just took one leg and just straighten it, and then bend it, and then straighten it, and then bend it, letting your thigh still rest on the seat. That's called a long arc quad. It contracts your quad muscle in the front of your thigh. That's a real easy one to do. You could do that anywhere, really. The next one is a straight leg raise. So I'm laying down, one knee is bent, the other knee is straight. I'm keeping that knee straight as I lift it up and down. The goal on this one is keep your knees straight. A lot of people have something that we call a quad lag, where the quad is not contracting fully. And you'll see when they lift their leg like that, the knee will actually bend a little bit instead of staying straight the whole time. And that's something we want to try to avoid. A really strong quad won't let that happen. So we keep it contracted. The last one down there is called a quad set. This one is where you put a small pillow or rolled up towel or something behind the back of your knee, and then you're going to tighten that muscle on the front of your thigh like you're straightening your knee further. Each of these you'll see written down some different hold times, sets, reps, how many do I do. Generally in exercise you're going to see us say do 3 rounds of 10. That's going to be a really common thing that maybe a PT would tell you. But we can change it. I'll have most people start with 2 rounds of 5 to 10 of these. Once they can tolerate that, then we'll go up to 3 rounds of 10, hopefully. Once you can do 3 rounds of 20, no problem, or 3 rounds of 15, no problem, you're ready for some weight. And that's when we can move into the resisted exercises. You could add an ankle weight on any of these. Very easy to purchase at Walmart, Amazon, anything like that, Dick's Sporting Goods. The last one is just a little bit different. Instead of the 2 rounds of 10, this one's just a hold. So I guess it is still 2 rounds of 10, 20 times. But this one you're holding for a bit longer. This is a type of contraction, a different type of contraction for the muscle where we just hold it, okay? So that one's like a hold 10 seconds, repeat it 20 times. So those are some examples of unweighted exercises. Now let's say we're ready to add weight. These are going to be examples of exercises in a gym. So the Y, Planet Fitness, if where you live maybe has a gym, if you have a home gym, I don't know. These are a lot of machines though that are typically in those more recreational gyms. So that exercise that I was telling you about, the long arc quad where you just straighten your knee, this knee extension machine at the gym does the same exact thing. Now it just adds weight to what you're doing. You want to, if you're ready for weighted exercise, you want to use enough weight that rounds 2 and 3 feel a little challenging. Like maybe if I'm doing 10 repetitions, on round 2 and 3, 8, 9, 10 feel pretty hard. That means you're doing enough to create change in your muscle and create growth. If you did, let's say I put 5 pounds on that thing and I'm going, I can do 3 rounds of 50, no problem. That is way too light. I need to add weight so that I feel challenged by my 2 to 3 rounds of 10. That's kind of our goal. Leg press is another one you'll see. Knee extension's primarily working the quad on the front of the leg. The leg press, is going to work your quads, your glutes, your hamstrings. It's kind of my favorite one that is all-encompassing for the leg. Now, both of these, a lot of people who have knee arthritis will tell me, hey, that hurts my knee. I don't think I can do it. If that's the case and you're exercising on a machine like this or any exercise, the first thing you want to do is drop the weight a little lower. If you're able to drop the weight and then do it with less pain or no pain, that's our first goal. If you can't do it without significant pain, even with no weight, we probably need to modify the exercise. And that's where the water can get a little muddy sometimes on how do I change it? What do I do? That's where trainers, physical therapists can be useful in that if you have questions. Let's see, these are 2 other examples. The words on the side are kind of describing everything I've already said. The knee flexion machine at the gym is very similar to that extension one, but instead of straightening my knee, now I'm bending my knee. That's going to strengthen the hamstrings or the back of the thigh. The other really important muscle group for our hips is going to be our glutes. So the machine at the gym where you sit and you push your legs out, it's called hip abduction, abduction, and that's going to strengthen the sides of your hips. It's a really important muscle group that's weak in almost every single person I see, no matter what age. I think it's probably the #1 machine at the gym I would tell people to do. So if you do go to a gym, find this one. I think in the YMCA, if you walk in, it's like right at the end of their cardio center on the far right. But that's one I'd say to do. Please. Right. You can put your feet on the other side and you go out. Yes. The weight the same for both? So it's going to depend on the person. So I don't do my inner thighs are the ones where I squeeze in are weaker than my outer thighs where I push out. Some people are the same. Some people can do the same weight either way. Some people are the opposite, where they can squeeze in harder than they can push out. I think that one's more common. The squeezing in's a bit easier. So what I would say is you kind of have to go through, if it's a new machine for you, or you're trying to figure out the weight, you kind of have to go through a period of trial and error of, let me do around at this weight. Was that too easy? Okay, I need to put it a bit higher. But it's very, I'd say, normal to have different weights for those.
So it's not a problem. I just thought it would become lopsided to have a much higher weight on one side than on the other.
Versus the other. You won't, and the reason for that is when your feet are in the middle and you're pushing out, you're working both sides of your hips on the outside. When you're squeezing in, you're working both hips on the inside. So it'll keep you even based on each muscle group. I would say both groups need to be strong, but naturally, a lot of people's adductors in their inner thigh tend to be stronger than their glutes. The goal would be that we could get even eventually, but a lot of people don't start there. Like I'm not there. I do different weights on both of them. You have to just mess around with which one's most challenging, but I don't think becoming lopsided will be a problem. Yeah. Any other questions? Cool. Okay, moving on from strength here, looking at stretching, and I'm just looking at my time here, I think we'll be good. Looking at stretching, we talk a lot about strengthening, we talk a lot about aerobics, walking, swimming, all that stuff. Stretching is really important too. If we get really tight and our joints don't allow us to move through their full motion, our muscles can't strengthen through that full motion. And so we're really doing ourselves a disservice if we don't do both. That would be a situation where you'd be lopsided, is if we get a muscle imbalance where one muscle's weak, the other muscle's really tight, and we get this kind of, what should be a well-oiled machine is some are tight, some are weak, some aren't as tight, We want to do both. We want to stretch and strengthen. So these are 3 examples of, particularly for the knee, again, because that's kind of where I'm focusing today. How can we stretch every muscle that goes around the knee? The first one's easy to do right where you're sitting. If you straighten one leg, keep the other bent, keep your torso really straight and just lean forward, you should feel a stretch behind the back of the leg. For some people, that's not enough of a stretch and you have to scoot to the edge of the seat. You have to put your foot up on something higher. It really depends on how tight your muscles are, but I'd say the majority of people can feel a stretch just with that one position. The second one here, I think is a little difficult to set up. It is a very good stretch, but I think it's a little difficult to set up. You kind of need to have someone else there to help you. But you're gonna tie either a strap or a rope or a belt, something around your ankle. You lay on your stomach, which I think is hard as well for a lot of people I see. And then you're gonna pull that strap to bend your knee. That's gonna be a really strong stretch, but again, I find it maybe a little too intense for some people. The alternative I would give, I don't think I have anything around here I can do this with, but if you have stairs in your home, if you have a kitchen chair, if you pull that kitchen chair next to the counter, or if you have a railing to hold on to, if you put one leg up on that chair and then keep your back really flat and then lean forward, I'm not gonna do it because I don't have a chair. I guess I can do it down here. Sorry, camera, I'm gonna move. If I was here and I kind of tuck my tailbone and flatten my back, and then I have something to hold on to, but I lean forward, I feel a pretty good stretch down that leg. That, I think, is an easier one to get into if you have things to hold on to. I'd say don't do it without holding on to something because it's quite a balance challenge, if so. But that's probably an easier one that targets the same muscle versus laying on your belly. That will be a stronger stretch, though. And then down here at the bottom, we have a calf stretch. So kind of going up against, they're against a wall, but I would just do this against a countertop, where you get one leg behind you and kind of put your weight into that ankle. So those are all the major muscle groups that cross the knee. We want to keep those really flexible. I'd say the most common one to have issues with is that the hamstrings and the calf, honestly. Usually the quads are just really weak, but all can have some tightness. To the left there, we have some descriptions of each of these exercises. The most important part, though, is the top. How long do I hold for? People don't hold their stretches long enough, ever. I'll tell people generally 3 rounds of 30 seconds. I think this says 3 to 4 rounds of 15 to 30 seconds. I read something one time, I can't remember if it was a study or something we learned in school, but it was like to actually get your tissue to lengthen, you need to hold a stretch at least 1.5 minutes. But 1.5 minutes of holding a stretch is a really long time. So I'll tell people break it up, because usually if you're stretching a tight muscle, it's not very comfortable. It doesn't feel very good. So break it up as you need to. If you need to do, 5 rounds of 15 seconds or whatever, break it up. I don't know if that's the right math, but break it up until you get to that 1.5 minutes. 30-second holds, usually I'll just start with someone. I'll just say, let me know when you think it's been 30 seconds. Usually it's been like 17, and they think that's 30 seconds. So I would encourage you to time yourself so you're accurate, and that way you know you've actually held the stretch for long enough. That's probably the most common mistake I see here with the stretching. Not really in a stretching note, but a balance and flexibility note. Tai Chi. Has anyone here ever done Tai Chi or heard of Tai Chi? Yeah? I really like it. I had an internship one time where we did some Tai Chi classes. It was like a community center. And it was really cool. I think really challenged your muscle strength and stability, because you kind of move. For people who haven't done it, you kind of stand in these like funny positions, and then you're shifting your weight from side to side, and then maybe you turn and maybe your hands are a part of it, and then maybe you're on one leg and you go to another side. It's kind of this like slow motion, almost dancing kind of thing, but really great for balance, flexibility, strength. A lot of classes will do it where you have a chair in front of you in case you need it, so that you don't fall, but really helpful. This says there's something called 24 form simplified Yang style Tai Chi. I don't know, I would just look up a community class if you're interested in that. I think the Y has some even that I've seen. And then yoga. There are so many variations of yoga. Yoga can be intense. I think I've seen some power yoga classes. And then there's just like your more simple stretching chair yoga I love. There's a really big variety with that, but a different way of exercise. Even though it might not get the heart rate up, it's still good. Then there's exercises we can do at home. So I think those are the best. I think getting to a gym where you have equipment or a class is phenomenal if you need that motivation. But the really easiest way to be consistent with something is have some access to some things at home you can do. So doing the stretches I had on those past slides, the front of the leg, the back of the leg, and then the calf, holding those about 30 seconds, I'd aim for that 3 times. And then the exercises below, we'll go through those real quick. 3 rounds of 15. If you can't do 15, the reason they say 15 is these aren't weighted. They're going to be just unweighted, no body weight exercises. So it has a higher rep count on there. If you can't do 15, start with 10. If you can't do 10, start with 5. Start somewhere. Something's better than nothing. And yeah, your muscles should just feel tired by the last set if it feels difficult enough. So the 3 on here or 4, I guess, on here that I think are really helpful to do at home. The first one's a hamstring curl. So this would be holding onto a countertop for balance. I'm going to stand on one leg, and the other leg, I'm just going to bend my knee and then straighten my knee. Bend my knee, straighten my knee. If this felt too easy, you could certainly add ankle weights, but usually if you do enough of these, you'll feel a pretty good muscle burn. That's the first one. The long arc quad we've already talked about. That's sitting in a chair, straightening the knee, bending the knee. The important things with these too is a lot of people are like, all right, I'm going to exercise. Let me do this. I'm just going to keep going really fast. That's not beneficial for our muscles. We need to go slow, which is annoying for a lot of people, but we got to go slow in order to work the muscle for a longer period of time. So the pace I would tell people is go up, a slight pause, go down slow and controlled. With the long arc quad, same thing. If I'm sitting, imagine I'm sitting, and I'm doing this one, a lot of people want to just go, 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 go. We want to do slow, slight pause, bend. Slow, slight pause, bend. I also think the joints appreciate that slower pace as well. A lot of the real quick can be somewhat aggravating for some of that. Let's see. Sit to stand. So that'd be like sitting in your chair and you stand up and you sit down. You should be able to do that without using your hands. And I'd say most people I meet that I'm seeing for PT struggle with that. But we should be able to have the balance, the flexibility, the strength to be able to do that. Of course, unless there's any other outstanding orthopedic conditions, but I'd say the average person should be able to do that. So it's really important to practice. And from a variety of heights, so let's say the chair you're in right now was just a little too low to not use your hands. Do a higher seat. So maybe your dining room chair is a little taller. Maybe your bed is a little taller than that. The taller the surface, the easier it's going to be to perform that exercise. This is a common one too. People will tell me gets the knees going pretty good. And so I'm going to come down here, camera. But can people see me? If I'm down here, whoa, that's really low. Holy moly. I might use my hands, I don't know. Let's say my right knee really bothers me. A lot of people, when they stand up, will do one of these, where their weight is not on that right knee. So the challenge to you, if you are having difficulty on that side, is to try to stay more even, because the more we get our body used to that shift, even when we get stronger in the days we're feeling good, we're going to be used to that habit now. And so we're going to keep doing it. So the goal would be, let me try my best to keep my weight even and then stand up. Another thing I'll see is if people have really weak hips, their knees will do one of these, where they kind of cave in. My knees go in. My knees should stay out over my toes when I sit up and stand down. Stand up and sit down. There we go. But a lot of times they cave in. So if you find yours are doing that and you can't feel it and you can't really do anything about it, that would be a sign you need to strengthen your hips and you need to do that abduction machine at the gym where you push your legs out. The other one on here is a squat. A lot of people hear squats and they feel nervous. Am I going to use the right form? I don't know. Are my knees going too far over my toes? We tell people to hold on to a countertop for a few reasons. Helps with balance, but then it also gives you typically the right mechanics. A lot of people will do a squat like this, where their knees are way over their toes. There was at one point a whole line of thinking where it was like saying, oh, your knees can't ever go over your toes. That's not really true. It's just if your knees go over your toes, it does put a lot more pressure into the knee. So if you are someone who has knee pain, maybe we should do it in a different way. So I'll tell people, hold on to a countertop, and when you squat, think of not knees to the counter. Imagine you're sitting in a chair and my bottom needs to go backwards. My knee is now not as far forward, and that'll take a bit of pressure off the knee and work on strengthening more of the glute muscles that we're going for. On that one too, again, a lot of people with the knees will do this, where if they squat, ooh, my knees kind of go in like that. That's hip weakness. If you find yourself squatting and your knees are doing that, that's your hips. So we need to strengthen the hips. So that would be that machine at the gym. Or seeing a PT to ask about what are different exercises at home I could do to strengthen the hip. A quick Google search will give you a few. But if you're having issues and it's flaring pain, usually an assessment by a PT is, I think, worthwhile, but I might be a little biased. Okay, so earlier I talked about we were talking about exercise amounts and, okay, I need to do 150 minutes of aerobics and I need to stretch and I need to strengthen. That feels like a lot. How do I do that all in a week? I feel confused. This feels a lot. This is just an example that someone wrote up of what maybe you would do. Maybe Sunday I stretch. Maybe Monday I strengthen and stretch. Maybe Tuesday I walk and stretch. Maybe Wednesday I stretch and just do some stuff at home. Maybe that's the flexibility or the exercises earlier we talked about, the squat, the sit to stand, those things. Thursday, maybe I'm gonna walk again and stretch. You notice it says stretch every single day on here. Stretching is important. Friday, I'm gonna strengthen again. So that's the other thing with strengthening. Some people think, I need to strengthen every day. I'm excited about it, I'm gonna do it, and I'm gonna do it good. If we're challenging our muscles enough, a day or two of rest is very helpful for helping our body heal that muscle before we do it again. So splitting it up with a day or two, I know there's like 4 days in between on this one, but splitting it up with a day or two of rest in between is very worthwhile. On those days in between, let's say you wanted to strengthen other muscle groups. I'm only really talking about the knees here, but let's say I want to work on my arms or I want to work on my core a little bit. You could certainly do that in some of those other days. But this is just an example of if we are solely working on the knee. Okay. Again, 150 minutes is a goal for moderate level exercise. And it's okay to have rest days. The example here doesn't account for any rest days, but they're okay to have in there. 30 minutes a day, 5 days a week would get you to that 150. So it's kind of our basis we go off of. Some tips for exercise. We want exercise goals we set for ourselves to feel achievable. So I'm not gonna set a goal for myself to go run a marathon because I hate running. So that's not realistic for me. I'm not gonna set a goal for myself to leg press 500 pounds. That's not realistic for me. But I could maybe walk a 5K. I like that. I could maybe leg press 50 pounds, 100 pounds. I like that one. So achievable goals to keep yourself in a good mindset are helpful. Exercise should be pain-free within reason. There's a slide coming up that's gonna say, when do I need to slow down? When do I need to adjust? But it should be pain-free. This is not an example like some people after they get a joint replacement, we gotta work through some pain sometimes. We just have to push through it. This isn't really, arthritis isn't exactly an example of that. If your body's truly really painful, we want to respect it a little bit and maybe modify the exercise or take a rest day. Very important to find exercise you enjoy. Again, I'm not going to go run. I hate running, but I'll go do some weightlifting or some biking or swimming. That's more enjoyable for me. So you got to find what you like. Exercising with friends. Some people are very motivated by a class setting. It's a little more social. There's someone guiding you in what to do. I know the Y has a really good, I think they call it active older adults, but it's a really good strength balance aerobics type of class. Very popular. They have it in the big gym over there. They have some silver sneakers classes over there too. Lots of varieties of classes, but some people thrive in that class setting. I don't thrive in a class setting, so I wouldn't choose that for myself. I would go more on my own. So you got to find that setting that works best for you. Wearing the right equipment is useful. So some people will show up in flip-flops and jeans and a really heavy coat, to work out. It's important to wear clothes that are flexible, well-supportive shoes, things you feel good in, especially with a lot of walking. We don't want to create other issues, maybe in the foot or ankle or back. We want to wear the right equipment and footwear, shock-absorbing shoes. Good info on shoes down here. We should change them out if we are doing, let's say we're runners, if we were runners, we should change those shoes out every 3 months. But if we're doing walking, then every 6 months. For more that low impact exercise. In my opinion, that's pretty often, but maybe I just don't buy shoes that often. But helpful to keep in mind. Mine probably could use a replacement. It's a good reminder. So here's the stoplight I think is useful to follow when you're exercising if you are having pain. A lot of people, when I'm doing a session with them for therapy, they'll say that hurts. And so I'll usually ask them, all right, give me your number out of 10. I usually hate the pain scale. However, it's useful in this note. If 10 is the worst pain you've ever imagined and 0 is no pain at all, if it's a 0 to 2, keep going. Keep doing it. It's just a little sore, just a little crunchy, doesn't feel great. Keep doing it. If it's a 3 to 5 for you, okay, we should probably listen to that. Maybe I need to reduce the weight or not do as many or change the exercise. That would be worthwhile. If it's a 6 to 10, maybe I need to take a break for the day. If what I just did really shot up my pain, maybe we need to rest, see if that recovers, maybe seek some help on how can I adjust that exercise, what can I do for it. So use that as kind of your guide when exercising. If you are exercising, and let's say you begin and it's been your 2 to 3 months of finding a rhythm, and your pain is worse, just flat out worse, and you've tried modifying and you've tried doing things, that's a time to seek help. See your doctor, see a PT, see someone about what am I doing wrong, what can my body handle and not what can we change? How can we treat it? Let's say it's one session and it really flared your pain. I'd say taking a rest day is useful, but stretching, light walking, something that works aerobics without too much impact on the joints is like ellipticals or like recumbent bikes, or I know at the Y they have like the new step, the steppers. Those are all really good low impact exercises. A lot of people think, again, they need to push through the pain. You don't have to. Exercise is really important, but listening to your body is as well, right? We kind of want both. When should I see a PT? So let's say you're exercising and you can't find the right rhythm for you. Your pain is getting worse. You've just general questions about it. You feel like you need some guidance on it. Come see a PT. There's a lot of PT places around here. Yes, I'm with Premier, so I'm a little biased to our own locations, but I think there's a Dreyer down the road, there's a NovaCare down the road, an Athletico, Kettering has sites. There's a lot of different PT places. I think most take most insurances, but shop around for the one you like best. The one thing I do like about our location with the Y is that we do have a good partnership with them. I'll have plenty of people that are hoping to get started at the Y or maybe have tried getting started at the Y, but they just haven't found the right rhythm. So when they're with me, we spend a few sessions in the clinic, but then maybe we go to the Y and we start doing our sessions over there and we're using the equipment that you intend to use so we can find the right setup or the right way to modify it. So. With PT, we're going to look at more than just strength. We're going to look at range of motion, flexibility. How are you walking? What are the joints around the involved joint doing? Like some people, their hip hurts, their back hurts. The issue is their ankle. Sometimes we can't identify that ourselves. We need someone else to take a look at it for us. So, benefits of PT, they call it conservative care for a reason. It's because it's pretty low risk. Typically, non-pharmacologic treatment, safe, effective, used to manage arthritis and improve your quality of life. Main things we work on are strength, range of motion, flexibility, functional movement. I do a lot of helping people get on and off the floor. I just helped someone the other day figure out how will she get in and out of her bathtub, because she does that a lot, takes baths for her pain. So there's a lot of mobility things we can work on. Lifestyle modifications, again, your gait pattern, what's best for you. We're here to serve you, and we want to help you with your individual goals and particular things you need. So, things to take away from this. For knee arthritis, exercising is better than not exercising in controlling our long-term symptoms and overall maintaining your day-to-day participation in your tasks. If you did not have a regular exercise routine before, it's never too late to start, and you can start small and build up from there. You got to start with what you're comfortable with. Strengthening in the quads, hips, calves, those are the main shock-absorbing muscles within our legs with walking, everyday tasks. Those are the really important ones to keep strong. Balance and stretching are a big part of it. Tai Chi and yoga can be within that. Holding our stretches long enough is probably the most important part I want you to take away from the stretch aspect. Consistency and finding something you like doing, I think, are the other really important takeaways from this. Exercise doesn't have to be punishment. It doesn't have to feel horribly overwhelming. It can be simple and should be something that feels enjoyable. aging is a normal process of life, but a PT can help you achieve the goals you have with improving mobility and your quality of life. So again, we're here to help you guys. Here's all the references that were used. I want to thank my colleague Qasim Rizvi for making this PowerPoint that I so graciously took from him. That was amazing. And thank you all for sitting through my lots of talking.